Okay, Madam Clerk, have we got NZNO queued up? Oh, no. Yeah, no, we've got, yes, NZNO, Nurses Organisation.
Yep, they're here in the room.
Yep.
Oh, very good. Very good. Have we got Kerri and Paul?
Correct.
Very good. Okay, you guys know the drill. We've got 10 minutes. It'll be good. I suspect members may have a question or two, so leave us that opportunity if you can. We look forward to it.
Thanks, Chair. Ko Paul Goulter toko ingoa, ko o te tūmaki o te tuputanga tapui kaitiaki o Aotearoa. I'm Paul Goulter and I'm the CEO of the Nurses Organisation.
Kia ora koutou katoa, ko Kerri Nuku toko ingoa, he kai whakahaere tōputanga tapuhi kaitiaki o Aotearoa.
We want to keep our submissions brief because we do want to get into the Q&A. I'm just going to do a few general comments. First of all, overall, we oppose the bill, and surprisingly, it ignores for us the place of Te Tiriti in Aotearoa, New Zealand, and so breaches it. We see it as promoting a supremacy of individual property-based rights over important collective rights. And thirdly, it is unnecessary and promotes a further regulatory load and bias. And other points have been made by other parties around these points. What I want to talk about briefly is the threat to our public health system that we see the bill posing. New Zealand's long had a public health system. While obviously, and it's well documented, it's under stress currently, there is a strong consensus we see across the country that for reasons of equity, accessibility, affordability and public health, this public health system should be continued and continually improved. A public health system is a collective right of all New Zealanders. The direction of the bill threatens the collective right by holding it secondary to the individual right. For example, the fluoridation debate is an example of that tension. Public health initiatives that protect communities will be held subject to the individual right to not be protected, even if this puts at risk the health of the community at large. That's clearly untenable in our society. Likewise, an individual property right to build and own a private hospital could be subject of compensation when a government, for perfectly good reasons, for example, equity, ceases to contract services to that private hospital, even when the private operator took on that risk in the first place and has priced it in. And I can assure you that nurses, even those working in private hospitals, do not accept that. Kerri.
Kia ora, Paul. As the kai whakahaere of tōputanga tapuhi kaitiaki o Aotearoa, I represent the voice and aspirations of Māori members, Te Runanga o Aotearoa, and am responsible for organising, progressing, advocating and actioning tikanga Māori. Māori nurses and healthcare assistants are in a unique position. They witness every day the inequities in the health sector, which make Māori more likely to suffer from preventable illnesses and comorbidities and lead them to shorter lives than non-Māori. Our people are dying already at a faster rate. Te Runanga have grave concerns the bill will continue to perpetuate these health inequities. In an attempt by ACT Party to expunge history and the intergenerational trauma of Māori, which has left many fearing the traditional health sector. That fear and mistrust of doctors and hospitals has resulted in Māori being more likely to suffer from health conditions and chronic diseases, including diabetes, asthma, heart disease and lung cancer. They are less likely to have been immunised and more likely to die from suicide. Māori are also more likely to face the barriers to accessing health care and to have experienced discrimination in the health system. These stats are a national shame. Evidence and history tells us that Māori and iwi-led health services are key to improving health outcomes for Māori. We saw during COVID pandemic a significant improvement in Māori immunisation rates once iwi providers were able to offer a kaupapa Māori whānau-centred vaccination services. These services were enabled because of considerations by policymakers of Te Tiriti of Waitangi. NZNO acknowledges that the pre-existing rights of Māori as tangata whenua and Te Treaty of Waitangi as the founding document in Aotearoa, New Zealand. Te Treaty provides a foundation to help fix the serious and dire health problems faced by Māori. It's because it pushes law and regulation makers to ensure Māori have the same access to opportunities as non-Māori and fully participate in decisions which affect them and to have their voices heard. The Regulatory Standards Bill will remove the Crown's obligation to Te Treaty of Waitangi and silence the voice of Māori in decision-making in health. This has deadly consequences. It will undermine the principles of equity and justice for Māori. It will perpetuate colonial structures of power and control over Māori communities. This bill is contrary to the government's legislated aim for healthcare provisions, the 2022 Pai Order Healthy Futures Act, which includes ensuring Māori and other population groups have access to services in proportion to their health needs, and that the health sector should take measures to protect and improve health and well-being. Tangata whenua have faced generations of systemic racism in the health sector. This means they are less likely to seek medical care when they are sick and more likely to drop out of the health system altogether. The Regulatory Standards Bill will leave a legacy for ACT leader David Seymour. That legacy will be that Māori will remain sicker than other New Zealanders. They will continue to die at a faster rate than non-Māori. And this is devastating for our whānau. We urge the Health Select Committee to recommend Parliament vote this bill down at its next reading. Kia ora.
Thank you.
Very good. Okay. Members, questions for the New Zealand Nurses Association? For Paul and Kerri, I'm going to go to Takata Ferris.
Tēnā kōrua. Given your history and work in the health space and the health equity lens, who in your view stands to be most significantly impacted, negatively impacted, in terms of health equity by this bill?
There is no doubt Māori will be most negatively impacted, and as I said in my statement, will continue to die at a faster rate when their voices are silenced from this piece of legislation.
Can you perhaps just give us your view on how Te Tiriti o Waitangi might actually provide for improved health outcomes for Māori?
If we were truly to implement Te Treaty of Waitangi as intended, any piece of legislation, any consideration of change should include Māori being at that table of decision. There should be equity in terms of shared governance, shared responsibility and shared funding to reduce and improve those inequities that currently exist. We are battling at the moment for those nurses that work within Māori and iwi provider sectors to be recognised the same as their colleagues that work within hospital. This has been over many, many years and we still haven't achieved that. So truly to embed a Te Treaty approach will include having people at the table and resourcing it adequately.
Tēnā kōrua.
Okay, very good. We're at time. Thank you, Paul and Kerri from the New Zealand Nurses Organisation, and we appreciate you coming into Parliament this afternoon and making your submission and your additional comments.
Thanks, Cameron.
Thank you. All the best.